Hey, welcome everybody. We're so excited to have you here today. We have a really special presentation for you with Donna Bouchow from the Aesthetics and Wellness Alliance. And Donna is actually the CEO of the Wellness Alliance, and she's been in the health industry for over 35 years. She's an educator, a therapist, and a spa consultant. She has put different curriculums into place with some of the turnkey anti-aging practices and solutions for spas. And we are just so excited to have her talk to us today about the microcurrent. Donna has owned her own spa. She's a massage therapist, and we are so excited to get going. So I'm going to hand this over to you, Donna, and I'm going to highlight you here so we can all see you and your screen. And thank you everybody for joining us today. We're excited to have Donna.
Thank you. Thank you so much for being here on a Saturday with me. I really do appreciate it. And I'm excited. We're all going to look 10 years younger in 10 minutes after today. So like Kelly said, we're going to be talking about microcurrents. And why is it there it goes. Okay. So microcurrent is known as a non-surgical facelift, lunchtime facial. It has a lot of therapeutic benefits as well as cosmetic benefits. I actually teach a lot of healthcare professionals on the therapeutic side of things. That's where I started with eye health, bone health, dental, muscle re-education, also stroke patients, and then oncology aesthetics. So again, there are so many benefits to this, and we're actually going to work more on the cosmetic side today. And I'm going to be working with this little guy right here. I call it my iPod of anti-aging, my little wrinkle iron. It's an FDA approved class 2 medical device. A little history of microcurrent. 200 years ago, a guy named Luigi Galvani, he discovered the human body conducts electrical currents, and he was practicing with frog legs, and he got them to jump, and then he realized, oh my God, I'm onto something here. It was first used in medical appliances and applications in early 1900s. There were lots of different devices that they had back then using microcurrent technology. It was in the 1940s where they started using it for bone healing, in the 1950s for needleless acupuncture, and then in the 1975 for Bell's palsy and strokes. And that's where I really started. Mine was not in 1975, of course, but I started practicing with microcurrent in the treatment of Bell's palsy and strokes and physical therapy. And I used it for muscle re-education, as well as I trained doctors to use it therapeutically. And this is a patient of one of the doctors that I had trained on the microcurrent. She had a stroke. Basically, Bell's palsy is a stroke, and you lose that muscle memory. And she couldn't open her eyes, she couldn't drink out of a straw. And this is about a 3-week process. So 15 minutes a day, 2 to 3 times a week. I would have patients that I would work on personally, and then when they would go home, they were able to start drinking out of a straw. They were able to start opening their eyes. I had a lot of doctors send people to me for that because, a lot of doctors weren't trained on how to deal with this through microcurrent. So this is such an incredible technology, and I'm just so passionate about it. I also worked cosmetically with it, teaching at a lot of aesthetics and cosmetology schools. We used it for vein treatments in vein clinics. We worked with it in so many different ways. It's just, I can go on for hours on all the different applications. But the main thing is I used to teach old school versus new school. So with old school, they have the big standard boxes that you really can't walk away with all the probes and the wires and all of that kind of stuff. And I love talking with my hands, as you can tell. And so that would not be very cool with those standard devices because you could burn someone. You cannot lose contact with your client. What I love about this is I can do whatever I want. If I take it off my skin and I leave it off for a set amount of time, it's going to turn off, but it will not burn anyone. So I like that. You can also travel with it, which is really cool. You can take it anywhere. So microcurrent mirrors our body's natural electrical current. And that's another reason it's so non-invasive. You can't really hurt someone because it works with your own body's energy. If you have an injury, and believe it or not, wrinkles are nothing more than wounds. And we create them and we can get rid of them. And I'm going to show you that today. Yes, we can get rid of wrinkles. So again, when we have an injury, our natural body's energy goes around the injury. When we use the microcurrent, it sends it directly into the injury. So we have faster repair in the tissue, faster healing. So how does it work? The best way to describe it is you have a negative and a positive. Your negative is going to be your detoxification, and your positive is going to be your healing current. That's the one that's going to drive your products in and make them more effective. Whether they're a medical product or a cosmetic product, it becomes more effective by 80% after a treatment. So the anaphoresis, which is your negative, it basically opens your pores, and the cataphoresis, it closes your pores. It increases the blood supply on the negative, and then it decreases on the positive. On the negative, it's going to liquefy the debris in our tissue, and then the positive is going to firm the tissue. So the cosmetic benefits of microcurrent is going to increase circulation. It's going to help with connective tissue, elastin, and collagen, and facial toning. And there's a study that if you Google this, you're going to find it everywhere on the internet. There was a study done out of the University of Washington School of Medicine, 200% study that 200% change in healing in your tissue, 14% collagen production, 48% in elastin, and 39% in blood circulation. Again, this device is amazing in what it can do. Also, it increases ATP by 500%. So what that means, ATP is our energy in our cells. It's the building blocks. Basically, it's going to help to rebuild the thinner parts of our skin, fill in the wrinkles, lift the sagging, and it gives us that energy to repair. It also helps with DNA replication. The other thing is with ATP, they say that a healthy body will use their body in weight, ATP in their body of weight daily. And by the time that they hit 60, they've lost about 50% of that production. So again, this is another thing. It increases that muscle re-education. When I was working with my patients, and this is going to be for cosmetic as well, but coming from the therapeutic background, I would have people work through their injuries, and I would work with the microcurrent to re-educate that muscle and to decrease the pain, because it also helps decreasing pain medically. That's how we use it. But cosmetically, it's going to bring that lifting and that toning back into your skin. So microcurrent, the aesthetic challenges that we're dealing with is acne, dark circles, wrinkles in the skin, rashes, recent breakouts, moles, skin tags, rosacea, hormonal imbalances. I have a device that I would look under people's skin, and in the spas, they use something called the Visia. They have different technology now as well, where when you get a treatment, you can kind of look at the before and look at the after. We see at least a 6% reduction of lines, wrinkles, pores, and texture with one treatment, which is pretty significant. So right now we're going to actually go off screen, and I'm going to show you some contouring techniques. And I gave everybody a little skin analysis to print out, and I put my little squiggly lines on here where I do my techniques, so you can make notes with this as well. I'm going to go off screen, and we're going to go through some contouring techniques. Hopefully I can get it back on screen after. Okay, can everybody see me okay? Alrighty, so, okay. So the first thing we're gonna do is we're gonna look at the jowls, and we wanna lift the jowls. So we're gonna go in underneath the chin, and we're gonna go up behind the ear and hold, because we wanna bring that muscle memory back. So we're gonna bring it up to the ear and hold. Then we're gonna go in front of the ear and hold. Again, we wanna bring that muscle memory back. So we're gonna go really slow and firm on the skin, but we don't really want to push. We just want to be very firm with the skin. Lift and hold. Okay, so that's for the jowls. Okay, so now to deal with the frown lines, the character lines, actually the character lines in the face and the main part of the face, we're going to actually come up around the nose, come straight up, and then we're going to go around the eye to the forehead, and then we're going to come back down. So we're going to go up and then around and then come back down. And we do that about 3 times for all these techniques, about 3 times. You could do it 5 times if you have an area that you want to work on more. So that's for the character lines. Now for the eye, we're going to pump blood to the eye. And this is for droopy eyes. So we're just going to kind of pump the eye, the blood, the circulation to the eye. And then my favorite, and I used to work, this was used, being used by a lot of celebrities. And I actually trained with Madonna's makeup artist. She had passed away a few years ago, but we had trained with her. She actually used one of the techniques that I use, and this is called my sit, pivot, and lift. This really opens up the eye. I use this a lot with my doctors, my eye doctors, because it helps with AMD. It helps to open up the eye, helps with a lot of different eye issues, but also helps you see, because you know when your eyes are all sagging, this is going to open them up. So basically, it's a sit right under there and a pivot, and then a lift. And when you lift, you want to make sure that you come back and you work the whole brow. You don't want to work one part or you're going to be looking kind of funky, because it will lift your eyebrow, but you want to make sure you're working the whole brow so you get the whole brow to lift. Okay, so it's a sit, pivot, and lift. And you can count like to 5 so that you're really getting a good concentration. We also have a smaller head, and then if you have a professional device, you have a smaller probe that you can really target. But you can use the smaller head if you really have more issues around the eye to really target the current to that area that you want to work. Okay, so that's for the eye. If you have crow's feet, you can also do some circular motions and then pull out and iron them. So I kind of do some circular motions because, again, any lines we have in our face are basically wounds from our facial expressions, and we can get rid of those. So we want to break up that scar tissue that's holding those that position. So we're going to kind of circle right here. We're going to kind of come out and iron out those lines. Okay. Now, for the same thing between the eyebrows, a lot of people have the squint lines right here, frown lines. So we're going to also work to break up those scar tissue by doing circular and then coming out across those, the forehead. Circular, coming out across the forehead. And you can work on that as long as you feel, you know, you've gotten a good, because you can start to see the skin change when you're watching yourself in the mirror, and you'll start to see how long you need to work or where you want to work more or how your skin responds. Everyone's skin responds differently. So the techniques may cause a different reaction for every person. You'll find that the correct techniques for you. Two more techniques that we'll go over. There are so many I can show you, but for time, we're just doing the basic ones. If you want to thin your face out, you're going to come up straight, up towards the nose, okay? If you already have a hollow cheek, and you see when you do that, if you do this stroke and you're coming up under the cheekbone and you're doing these upward strokes, and you want to hold under the cheekbone because we're trying to lift the cheek, but we're also thinning out the face at the same time. If you see that you're starting to get more wrinkles under your eye, or you already have hollow cheeks, then you want to work on an angle. So you want to come out towards the ear and work as well. So you're going to come up towards the ear, but you're going to sit under that cheekbone. Okay. Because we're really trying to lift. And like for me, I call it chipmunk cheeks. I really have to work on my cheeks. I need to kind of really work them and get them out this way. So for me, it's more the jowls and more working my cheek, okay? Which is really going to help pull that out if you have the same thing with me, sagging cheeks. Now, for the last technique I'm going to give you is for your lip. No, 3 more techniques, sorry. Lips. For the lips, this is really fun, okay? And I actually am going to do my lips and see if we can see them plump up. I don't have a mirror, so it'll be my mirror. I'm just going to put peptides on my lips here. I'm going to turn my machine on. My hand is already wet, so making sure the metal is wet in the back for the contact. I'm just going to put it on for 3 minutes. I'm not going to do a full 3 minutes. But what you want to do is kind of just work across your lips. Okay? First thing you're going to do is just kind of get the blood going. All right? Then I'm going to kiss my spa because it's going to poof those lips out. If you have a wand, like probes, you can actually do a popsicle. And then that'll help to poof those lips out. And this is really cool. It's not a permanent. This is not going to be permanent, but it's fun if you're going out for the night and you really want to get those lips poofed out. The other thing is you can change the head, which I'm not going to do right now. And you can do target the current directly into your lip to get a lot more stimulation. And you can do pressure points. And you can do 3 points. 1, 2, 3. 1, 2, 3, and then you do them on the bottom lip. 1, 2, 3, 1, 2, 3, and just work those lips. And you'll start to feel the circulation. You'll start to feel your lips getting bigger. They're starting to get warm, so I think they're starting to circulate a little bit. But that's enough for demo. I'll just leave it there, and we'll move on. But it's fun. I love it. The next thing is double chin. You want to do circles under your chin. And I just work the jowls at the same time. So I do circles, and then I just kind of lift up, come back under, do circles, and then lift back up. Let me put a little, let's see, where's my oil? Let me just put a little oil on. I don't want to put the goop on my face right now, but I'm just going to put a little oil so that when I'm moving around here. Okay, so when we're doing the circles under here, and we're moving, we're just going to kind of come, do circles, and then work the jowls, circles under here. Can you hear me? I'm like mumbling. You get it, right? Okay, so to thin the nose, we're going to come up and out. So you're going to come up around the side of the nose and come out, come up, come out. And again, for thinning the nose, if you really want to thin it, use the smaller head or smaller probe, because that will actually bring that current directly to that area that you really want to work. So those are some of your contouring techniques that you can use. Now I'm going to show you some of the results. We're going to go back on screen. Hopefully I can figure this one out. Okay, there we go. Yay, it's working. Perfect. Okay, so let's go to the next screen, next slide. Come on. Hello. There we go. Nope. Of course, technical C. Let me get out. Hold on. See something. Okay. A little hesitation with going on and off screen. I may not do that for the next one then. But anyways, this is someone that we know very well. It's a friend that I worked with. And I did a 15-minute treatment on her. And you could see, oh my God, look at this, 15 minutes. Remember I told you that you don't need wrinkles and you can get rid of them? Look, you can see it right there. Look at her eyes, look at the crow's feet, look at even the neck. Can you see how lifted that is? That's the one thing I don't like about doing a Zoom class rather than a hands-on class, because I could be working on all of you and you could all be looking so amazing, and then I'll just do one side and say, oh, you got to buy the machine to get the other side. It'd be fun. Anyway, it's a lot of fun and it's amazing results. But look at, you can also see on this one how lifted her eye is. You can see that the cheek is pulled up. The strokes that I was telling you, that really lifts that cheek. And then here, again, you can see the dissipation, 60 days. You can see the difference in the texture. You can see the difference in the lines and the wrinkles. And again, this is a cumulative. So when you do this treatment, it's going to continue to build on those results. You're not going to do a treatment and then the next day go back to what you looked like, unless you just stop and you don't do it again. This is cumulative. You have to do it 2 to 3 times a week. When you get to a point where you're happy, you can start slowing down to maybe once a week. You're going to slow that aging process down. You're going to get that cell turnover with the ATP. You're going to start to diminish those lines and wrinkles. But you have to take the time to do it. This is a 5-month transformation. Can you see the difference? I mean, look at how much she looks so much younger, more vibrant. All that sagging, everything's lifted. And then this one blows me away, and me and Kelly, maybe someone else that's on here also knows her, but look at this, 65 years old, 70 years old. It looks like her sister, doesn't it? It's amazing. Again, a cumulative process, transformation. We're not meant to have wrinkles, and we don't have to live with them. So the therapeutic benefits. It improves metabolism, sensory nerves, circulation. It restores muscle tone. In the medical industry, we use it to mask and help with pain, especially like with TMJ with my dentist. Improvement in soft tissue regeneration. It enhances the healing. And what we're going to be talking about is the lymphatic flow. So your skin is the largest organ of the body. Skin renewal takes place every 28 to 60 days. Okay, there are three areas: the epidermis, which is the protective shield for your body, the dermis, which is your structure and your support, and then the hypodermis, which is the insulation and padding for your body. Now, we're going to do something fun, and it's only for 5 seconds, but if you want to see where you are with your skin's complexion and the elasticity, if your skin is older than your genetic age, if you're right on target for where you need to be, or if you've got that little cushion where we're much better than where we are genetically meant to be. We're going to take, and I'm going to time it. So let me just make sure my phone is ready here. It's 5 seconds, so I'll tell you when to go and when to stop, and then we're going to count. So you're going to grab the top of your skin and you're going to pull it, okay? And we're going to hold it for 5 seconds when I say ready. Then you're going to count 1, 2, 3, 4, 5. And based on how many times you count, I'm going to tell you where you fall, okay? So if we're all ready, go. Let's grab the skin. Stop. Count. So I'm about a 3. So if you were counted 1 to 2, I'm between 2 and 3. If you're between 2 and 3, you're 30 to 44. If you're 3 to 4, you're 30 to 44. If you are, I don't have my glasses on. I need work around my eyes. 5 to 9, you're 45 to 50. If you counted any higher than that, you're more like 60 to 70. So depending on where we are, I'm doing pretty good. I'm pretty happy. Okay. So inflammation, let me put this up to the side here. Skin inflammation like acne, redness, every time we see anything in our skin, any injury, anytime we're sick, there's inflammation. Inflammation is so key. We can do a whole presentation just on inflammation. Okay. It's a direct correlation to your internal health. And I had given everybody a skin toxicity sheet to fill out. If you didn't fill it out and you don't have it, basically it's just questions to kind of ask you about your health. And then you can kind of look at the skin and kind of see where you see things in your skin, which we're going to talk about, that correlate along with your health issues. And you can kind of see that when we're working on ourselves, maybe those things are going to change because that's a bonus. You know, when we're doing all this work on our face and our skin internally, we're making changes as well. Okay, so let's go to the next slide. I gotta put my glasses back on. Make sure I can see everything. Okay, so basically puffy eyes could indicate that your colon is blocked. If you have blue or yellowish skin, it could be a sign of mineral deficiency. Browning, it could mean that there's problems with the uterus. Jowls are problems with kidneys. The forehead, if you have deep lines, it could mean that you are have more of a sugary, rich diet. If you got a lot more redness in your forehead, that could mean that you're doing more sugary foods. So the deep lines are more for rich, oily, and then the redness is going to be more sugary. For me, I have the sunken cheeks, and usually with sunken cheeks, it's breathing issues. It's stress. I talk fast. I don't breathe as much. I probably need to slow down a lot more. But anyway, and the stress issues, that's in your sunken cheeks. So also, if people are pregnant, you're going to see a pink spot right under their nose. That's the placenta. You can actually see it when people are pregnant, which is really cool. Red ears or adrenals. If you have a line in your ear, some people have that little line on their ear, that's blood pressure issues. So it's really interesting when you start to look at all this and then you work on yourself and come back to it later and go, wow, those things are changing. So just some information. We could do a whole class on the lymphatic system, but we're just focusing on the face and some of the areas that we're working. There are 600 to 800 lymph nodes. 1/3 are in your face and your neck. So we're working on in front of the ear, behind the ear, in the neck, around the jowls and the eye. There are also lymph nodes in the eye. And then the forehead, there's also a lymph node that was discovered in the medical industry. They never knew it was there. And I'm going to show you something pretty fascinating about that in a little while. So again, this is just a picture to show you that there's a lot of nodes in your face and behind if you feel right behind your head, the occiput, that little groove, there's lymph nodes right there as well. I mean, you could just kind of work them and you start to fall asleep, literally. So there are so many conditions benefiting from the lymphatic drainage. Obviously, we're focusing today on the skin. 15% is on the skin, okay, that can be affected with the lymphatic system. So facial lymphatic drainage, it's extremely light, very, very light. If we're going to work any lymphatic techniques on someone, we want to do that before we do any contouring, because we don't want to push down on the nose. We want to work the lymphatic first. Again, it's the pressure of the weight of a nickel. It very relaxing. We're going to actually do some techniques with our hands, and you're going to feel very sleepy. You're going to feel that energy in your body. You're going to feel it. You're going to feel the lymphatic system working. So here are, and again, I don't know if we should go off screen. Kelly, should we go off screen again? You think after this? Hoping I can get back on.
Yeah, up to you.
Okay. All right. If you guys can see me okay, then we don't have to. I don't want to take a chance of going back on quick enough. So for the lymphatic system, this is really interesting. If you take your fingers and you do a triangle around your nose, and so everybody do a triangle around your nose, and everything that's inside this triangle drains down. Everything that's outside this triangle comes out and down, okay? So this is your main drain, your clavicle right here, okay? This is the lymph line right here, all right? So when I talk about lymph line, it's right here, all right? So anything inside drains down, everything outside the triangle goes out. So when we do these techniques, let me make sure I have all my techniques here. Okay. And I want everybody to do it with me, and we're going to use our hands. Okay, I want you to get used to the pressure and the technique. Then you can always come back in with your spot and do the techniques, okay? So this is the way you'll get comfortable with the technique, all right? And then you can get comfortable holding the device and doing them. And we're not going to go over how to turn anything on or how to, with the devices, because we all have different devices. So if you have one of these devices, depending on the model, we can get back together in no time and go through that. If you have your own device and you have questions, you can always call me and reach out. All right, so we're going to start right here at the temples, okay? And I'm going to do little circles, very light. You want to do very, very light. And I want everybody to feel this, okay? And then come straight down into the clavicle. And if you close and circle, and when you get used to this and you start closing your eyes, it'll really put you to sleep. Okay. And you do that about 3 times. We're opening up the drain. We're starting to get the lymphatic system moving. I can already start to feel chills. And if you start to feel chills, let me know. Then when you come up here, you can kind of come out across your forehead, circle around the temples, and come down into the drain. And you're doing that 3 times. Out across the forehead, circle at the temples, come down to the drain. We're doing that 3 times. One more time. Now, if you want to do it longer, you can. For time's sake, we're just doing 3 is pretty much good enough. Then we're going to actually come up along the nose. We're going to do the one for the character lines. We're going to come very lightly up along the nose, out around the eye, into the forehead, and then come back down. So up straight on the side of the nose, out around the eye to the forehead, come straight back down. One more time. Up along the nose, out around the eye to the forehead, come back down. Now we're going to come in on an angle towards the nose, come out towards the temple, and down. In towards the nose, out towards the temple, and down. Okay. For the eyes, we're going to actually go around the eye, out towards the temple, circle, and down. So we're circling the eye, out towards the temple, and down. Circling the eye, and you can reverse the direction too. Sometimes that's helpful with the lymphatic system, but for demonstration, I'm just doing it in one direction. And then for the forehead, we're going to come in upward strokes. And come down. Now for the lips and the nose, we're going to circle the lips. And then we're going to pump the nose. Circle the lips. Come back down. Under here, You can just kind of come up. Now, what I usually do if I'm doing a treatment on someone, I will start the lymphatic with my hands, then come in with my device, and then I'll end again with my hands. And I'll come and do this stroke to really kind of lift the jowls, and it feels good. It feels really relaxing. And you can kind of go around the ears. You can come across the forehead, come back down, and then you can end also with the triangle outwards. How does everybody feel? Can you feel it? Do you feel a little tingly and a little bit going on, circulation? All right, so now we're going to look and see some of the results. This is amazing to me, and I actually had someone take these pictures, so I was there. I did the treatment on someone. If you look at the picture where there's white and red and all the deep oranges, that's inflammation. And the white is TMJ. Someone had TMJ. They were actually going to the dentist that day. I did a 15-minute treatment on only one side of their face. And if you look, it dissipated the whole face. And you can see all the lighter colors. You can see the white is gone. That was just 15 minutes. So it helps to show you that we're moving that lymph system, we're moving circulation, the body is starting to do what it naturally is supposed to do. This is another picture. And if you look, I only did the neck. Matter of fact, I did this, I think Kelly, you were there. You might've been there. I did half the face. It was a demonstration I did, and it dissipated even the forehead. It dissipated the whole face. It got, the colors are all lighter, those yellows, those whites, they're diminishing. Now, when I was telling you that they discovered a lymph node up here, doctors would see these pictures and they would say to me, how is that possible if you just did right here? Well, it's because they discovered that lymph node up here that no one knew about. Back in 2015, there was a study that came out. So just an interesting fact for you. Now, here is where we see the change. Remember, I was telling you where we're looking at how the things that are in our body, our health, and all those things, how our skin tells a story. And when we start to make those changes, the body starts to make those changes. And so if you look, this is 1 month treatment. Look at all her acne, gone. And everybody responds differently. This is also for scarring. Look at that, 1 month. This is rosacea. Isn't that amazing? Now, this was actually someone that had a lot more clinical type rosacea, and it took her 12 weeks. That's pretty significant. And so treatment protocol is about 45 minutes when you go to a spa. It's about 12 sessions, and then you have to follow up. It's about 100 to 200 per session, average of 135. Results, obviously are cumulative, so you need to keep coming in to get those treatments. When you have a little guy like this, you could be doing it every day, or if you're going to get it professionally done, they could be doing a lot more of these kind of techniques, and then you could be using it to drive product benefits and maintaining those results at home. So it's just a matter of how the protocol. It's painless and it's relaxing. There's a general guideline. I won't go through them all, but basically 20 to 30-year-olds, it's more preventative. Then when we start hitting our 35 to 40, we're going to have to start doing it more. When we hit 50 to 60, we're doing it three times a week and having to maintain. Contraindications. Okay, one thing I'm going to say about the contraindications, if you have one of these devices, you can actually take the information to the doctor and they'll probably okay it because it's such a low intensity. It's so non-invasive. It's so much less than those traditional machines that you have to set. So I have a lot of people that have gotten approval to use it and they have metal plates in their hip. But the thing to know about this little guy, if you have it, is when you're working on your face, that current stays on your face. It doesn't travel through the body. If I take my hand and I put it on my hip while I'm doing my face, now that current travels to my hip. Does that make sense? So we want to stay within the area we're working. If we're working on someone else, I usually always have my hand on their shoulder or on their face, the opposite side. That current stays within that area. Okay, so it doesn't travel throughout. So if you do have any contraindications, you could take it to the doctor and say, hey doc, this is the device, I would like to use it, and then show them the currents and have them let you know if you can or not. But some of the contraindications, obviously, if you have metal in your mouth, sometimes you might have a metallic taste. Sometimes I don't even notice it because I do. You don't want to work like obviously on the eyeballs. You want to work around the eye when you're working on it. And again, if you have an open sore, you're going to feel the current. So don't use it on any open skin. This is like the end of the presentation. And what I really want to kind of get out there is if you are working with a professional or if you are a professional, this is the way to gain a competitive edge on the industry. Most dermatologists and surgeons, they don't really like the microcurrent because they go more for the Botox, the Restylane, and the plastic surgery. Okay, this is a non-surgical, safe, low-cost treatment, but it gives you the edge. It's pain-free. Your clients are going to have, or your, they're going to have more results with the products they're buying and they're spending their money on. You can do a facial bar. Come in at lunch, they can do a nighttime facial, then get their makeup done. It's a lot of fun. For the medical side of things, it's post-surgical facelift, maintaining the benefits. It treats blood stasis, scarring, numbness, and healing. It's a complement and asset to medical process, cost-effective equipment, and it's a new spa segment and revenue stream. So whether you're selling these to mom next door or you're selling them professionally, it's a new revenue stream, and it's a great device and it's so many benefits to it. I really hope you enjoyed today, and if you have any other questions, you can get back to who invited you. You can reach out to me. I do want to let you know that we do have a training coming up on September 6th. It's going to be how to stimulate collagen naturally. We did have this class, but it's backed by popular demand, and we now have some new information. We have some new IO technology that's going to be also that we're going to be talking about, and it's pretty exciting. It's like you're going to have the device talk to you. It's going to tell you where you are with your results. It's going to show, before and afters. It's going to tell you if you missed a spot and where you need to focus more. So I'm really excited about it, and I hope you are as well. I hope you enjoyed today, and thank you so much. Kelly, take it away.